Godmorgen og velkommen. Jeg hedder Bjarke Abrahamsen og arbejder her på Pharmakon i afdelingen på forskning og udvikling. Forskning i roller og opgaver for farmaceut er et voksende forskningsområde, og noget vi her på Pharmakon følger med stor interesse, da vi både uddanner og efteruddanner landets farmakonomer. Derfor så faldt det også meget naturligt, at vi inviterede Tamara Köhler til at præsentere hendes forskning, og jeg håber, at I er lige så nysgerrige, som vi er. Inden jeg giver ordet til Tamara, så vil jeg lige fortælle lidt om, hvordan vi kender Tamara. Vi kender Tamara gennem hendes arbejde i FIP, hvor hun både har præsenteret hendes arbejde tidligere, og hun har også bidraget med data til en stor FIP-rapport om, hvordan apoteksansatte andre end farmaceuter, de bidrager til pharmaceutical care. Tamara, hun er uddannet farmaceut fra 2008, og hun fik i sin Ph.D. i 2021, hvor hun fokuserede på udviklingen af pharmacy technician som profession. I dag så arbejder Tamara på FPZ Institute i Holland, hvor hun udvikler undervisning og også underviser apoteksansatte. Nu har jeg været på dansk, og nu vil vi fortsætte på engelsk, og jeg vil lige sige, at det her det bliver optaget, og det vil blive lagt tilgængeligt senere hen. So Tamara, I will introduce you in Danish, and we're all very excited to hear about your research. So please, the floor is yours.
Okay, thank you very much.
I will just stop the share so you can...
Excellent, so I can share my screen. Here
yes, please.
Yes, there we are. Well, good morning. Good morning from the Netherlands, and thank you all for starting your day so early, just to hear me talk. And thank you, Bjarke, for your nice introduction. I'm Dutch, I'm not Danish, so my ears were just a bit straining just now. Good to have you here. We'll do a webinar on the pharmacy technician and the research I did on it. And I'm under strict instructions from Bjarke to not get past 9:30, so we'll make sure that won't happen. And I just wanted to say I really would like your input as audience and some audience participation and questions and remarks, and discussion is more than welcome. So you can use the chat, or you can just ask your question in Danish. Everything is fine. Bjarke and his colleagues will help me out, and we'll get a nice webinar this hour. Okay, so first of all, today in the Netherlands, it's a bank holiday. It's King's Day. And I looked it up, but it's actually the equivalent if Queen Margaretha and her daughter-in-law Mary would visit one of the Danish cities. So today, as the arrow is pointing, our royal family is visiting the city of Maastricht, which is all the way south. So after this webinar, I will go and eat some cake. Okay, just to set the scene. Bjarke already introduced me, but just, short background. I'm trained as a pharmacist. I'm currently working as an assistant professor at the Faculty of Pharmacy at the Utrecht University. So I see students all day. And a few years ago, I had the opportunity to combine those two, loves of my life, education and pharmacy, in a PhD trajectory on the pharmacy technician. So today, what are we going to do in this hour that we have? I will provide you with a short introduction on the Dutch community pharmacy. Bjarke asked me to do so we can see where the differences are in your Danish context and my Dutch context. I will give you a short overview on how we train the Dutch pharmacy team. I will give you a very, very short outline of my thesis. No worries, it's not going to take forever. It's going to be very short. And then, just when you start to think, whoa, where's my second cup of coffee of today? I will look for some audience participation. So be prepared to, have your opinions and your questions ready. We will talk about tasks and supervision of the pharmacy technician. I will show you the data of my research, and I'm really curious to see how the Danish situation is. That also goes for point number 5, in regards education. I will show you the competency framework that we made. And I'm really curious to see if, the focus areas that we have in the Netherlands are the same as in Denmark. Then some practical implications, from all those years of research, what did I learn? What should we aim for when we think about pharmacy technicians and training them? And then Bjarke asked me to think about pharmacy technicians in the future. Well, that was actually a hard assignment, but I thought of some elements. I'm really curious to see, if that resonates with the Danish situation. And then if there's time, there's room for whatever comes up on questions and discussions, or, we can have a chat. And that's it. So that's what we're going to do today. Okay, so first of all, community pharmacy in the Netherlands. In the Netherlands, we have three kinds of pharmacies. We have the community pharmacies, just out in the street where you can go to as a person, mostly after a visit to the GP. We have secondary pharmacy care that's in the hospitals, and the outpatient pharmacies. I think the Danish pharmacies also have outpatient pharmacies, right, Bjarke? Oh, you don't? Oh, that's interesting. So for a population of over 17 million people, we have on average 2,000 community pharmacies. So that, roughly gets down to 7,300 patients per pharmacy. Would that be sort of, relatable with the Danish community? I see Bjarke nodding, so that's okay. In those community pharmacies, again, on average, 1.5 FTE is made out of pharmacists. So you have like a 1.5 pharmacist on duty per day. It's a number. And then that team is reinforced with pharmacy assistants, and they form the majority of the team. So their FTE comes down to 5.7. Interesting in this population, or the workforce, is that 98% of the pharmacy assistants are female. And then with regard to the pharmacy technician, I will just, enlighten us on what do I mean with pharmacy assistant or pharmacy technician. Since the start of the educational program in 2003, approximately 700 pharmacy technicians have graduated in the Netherlands. So there's still a small population in the Netherlands compared to the rest of the team. So in a Dutch pharmacy, what we had was a pharmacist trained at the university level, like what I'm doing right now with my students. And we had the pharmacy assistants. They were trained at the vocational education, which in Netherlands is like, the more hands-on professional education. But then over the years, we had this transition in pharmaceutical patient care. So really, the care focused not more on the product pills, but more on our patients. So the tasks of pharmacists got more complex. They expanded their task area. So actually they needed more staff, and they needed higher educated staff. And that's when they discovered the gap between, the university trained pharmacist and the vocational education trained pharmacy assistant. Not all of their tasks could be handed over to the pharmacy assistants because they didn't receive the training for that. And then the pharmacy technician happened, at least in the Netherlands. They are trained at the higher professional education, so their level of education really is a bit higher. And the main goals when designing this profession in the Netherlands were to support the pharmacist in providing pharmaceutical patient care, also coach the team of pharmacy assistants in providing that care, and also be some sort of bridge, keep in contact with the other healthcare providers, have contact with the GPs, phone a specialist in the hospital when there was a question about the recipe. Okay, questions so far on the Dutch situation? Bjarke, anything going on in the chat? Okay.
Nothing in the chat so far.
Good, then we'll continue. as I promised, I would give an overview of my research, like very short. So basically, the research contained so who thought of this profession, because it's not a Dutch thing, just as it is not a Danish thing. Pharmacy technicians start to exist all over the world. In the more Western-oriented world, the reason of their existence was just as I described. The tasks and the responsibilities of the pharmacist grew bigger, so they needed extra and higher educated staff. But in countries like most of the countries in Africa, there are not enough pharmacists. So what happened, staff from other medical healthcare professions would fill that gap. So in order to have pharmaceutically trained staff, pharmacy technicians were placed on those positions. Then we thought about the Dutch situation, because I was working at the educational program of the pharmacy technician, and we needed sort of a passport for the Dutch technicians. So that ended up in our competency study. So we designed a competency framework. And the last piece of work, I really enjoyed doing that one, was figuring out, okay, so as a starting pharmacy technician, what kind of barriers do you encounter when taking on this role? Because in the Netherlands, in the Dutch situation, a pharmacy assistant would start in the program for a pharmacy technician and graduate, and then keep on working in that same pharmacy, but now with an extra diploma and extra tasks to do. But you know what happens. The situation itself was the same, and then one of the staff members is different. So, how do we do that as a team? How do we make this role happening when nothing else changes? Okay. Small game. Where's Wally? I don't know what that would be in Danish, but I guess you all know that kids book, where there's this really tiny looking person with a striped shirt. I always present this slide when I'm showing my work, just to illustrate the stuff that's going on with the pharmacy technicians. So if I would ask you, the audience, to identify for me the pharmacist, what would you say? Ooh, I see all wrinkly faces. Bjarke, what would you think?
I'm a bit sad to say that on the pictures on the right, and this is really prejudicial, but I would expect the man to be the pharmacist.
Definitely.
And so also at the bottom left and on the top left, it could also, there's one man in each.
Yeah.
And it's awful to say it, but it could be the pharmacist.
Yeah, totally right. Totally right. Usually the audience would say the old guy in the picture would be the pharmacist. And then, of course, on this photo here, it's the lady. Okay, so, we could identify the pharmacist pretty easily. But if I would ask you to identify the pharmacy technician, no, right? I can see people shaking their heads. Well, actually, we've got pharmacy technicians over here. It's these for ladies. So they're there, but we don't identify them. We don't recognize them. Patients don't recognize the pharmacy technicians in the pharmacy. So that was sort of the main goal of my research, to, really get them more, to do a bit more PR for the pharmacy technician. Okay, so audience participation. I will show you a bit. My research has to do everything with tasks and supervision by the pharmacist, to say. I'm really curious to see how that works out in your context. What we did was within an FIP program, we sent out a structured online survey. It had open questions and closed questions, multiple choice questions. And we covered a lot of areas. So we were interested in roles that different pharmacy technicians would have, responsibilities, supervision, what was going on, How is the education and legislation set up? What are the scope and responsibilities of those pharmacy technicians? And, right, is there anything that looks like continuous professional education going on in your country? So it was an international survey. Pharmacists answered our questions, pharmacy technician, other stuff from the pharmacy, people that were into the educational program. So we had a very diverse audience answering those questions. We used FIP to circulate our survey. Maybe some of you actually got the survey. That would be fun. Okay. Large table. I will help you get through it. What we will focus on is the column of full supervision. So people answering questions on what kind of roles and responsibility require full supervision by pharmacists. What are the tasks that require no supervision at all? And what kind of competency areas do you not practice? To point out three that I was, curious about. Full supervision has everything to do with patient consultation and diagnosis. And full supervision really means that basically the pharmacist is looking over your shoulder. So you're more or less a duo when it comes down to this task. No supervision at all. The highest answer got back to procurement, stock ordering. And if you think about it, anyone that's trained in retail could do this. So I was really wondering about, why would we use a pharmacy technician, the higher trained staff, to do something that's has everything to do with just logistics, not pharmaceutical patient care? Then the competency area not practiced, we get back to this patient consultation and diagnosis. So if you get to do it as a pharmacy technician, you have the pharmacist looking over your shoulder, but a lot of them don't even get to do it. In the Netherlands, in our situation, that pharmacy technician really was sort of invented for that pharmaceutical patient care. So, our flag. If I look at this table and think about what Dutch pharmacy technicians would do, in the area with the competencies that are not practiced, a lot of the pharmacy technicians in the Netherlands are in contact with our health insurance companies. I don't know how that is in Denmark, but here it's sometimes really hard to get reimbursed for your medication. And pharmacy technicians really play an excellent role in hounding down those health insurance companies. We have a lot of patient consultation and diagnosis performed by the pharmacy technicians. And also, and I really like that one, the taking medication history of patients, and including medication reconciliation. So if a patient would be admitted to a hospital, first stop, a visit to a pharmacy technician and talk about the drugs that you use and why you use them and how that would affect your hospital stay. That medication history and the dispensing of medicines, there is some supervision in the Netherlands. It's not like those tasks are solely, for a pharmacy technician. But then again, the situation in the Netherlands is a pharmacist is required to register under the medical laws in the Netherlands, and the rest of the pharmacy team does not, because by proxy, the pharmacist is responsible for his team. So a pharmacist is registers just like a GP or a specialist, and the rest of the team is not. But, if they would make a mistake, the pharmacist immediately would have to take responsibility. Okay, a lot of talking already. I'm curious. If you see this table, supervision, no supervision, competency areas, what do you think? What do you recognize? What's different? Let me know. You can use the chat, or you can just, talk in Danish. That's okay. My ears can take it, and Bjarke will translate. Any questions? Any opinions?
I'm just keeping an eye on the chats. There's no one that really adds anything. Yeah, so there's a comment from one of the participants that the pharmacy technicians, they check the prescriptions but no supervision, and that is a much higher degree in Denmark.
Right.
So I would say, at least from my own experience, that the pharmacy technicians, they have a very high degree of independence, and there's some certain rules when they need to get supervision to have the work checked.
Yeah, I already got that from our FIP encounters, right? You have way more autonomy in your work as a pharmacy technician. Good. I like that. I can see Anna. You're a bit in the dark, but that's okay.
Yeah, can you see me?
Yeah.
Yeah, okay. I was thinking also the one giving medicine information and advice to patients is the main role for pharmacy technicians in Denmark. So I think that there will be no supervision as a high percentage from the Danish pharmacy technicians. Because that's what they do in pharmacy.
Okay. I think, from the short remarks from Bjarke and from Anna, I think we can conclude that if we would let the Danish population fill out the survey, it would be really skewed towards, some supervision, no supervision, a lot of more interesting tasks. That's a good one. You can be the role models, for the pharmacy technician in the rest of the world, or at least Europe. Okay. Next. Education. Are a lot of educational people present today? Bjarke told me we would be a mixed audience. I can see some people nodding. That's excellent. Okay, the competency framework. It was a method study. I used focus groups with pharmacy technicians and pharmacists to, hear people talk about what do you do on a daily basis? What does your work look like? We made up a first version of that competency framework, and then use the Delphi procedure to really get to consensus on the framework. And in that Delphi procedure, we added, the higher level stakeholder. The Dutch pharmacist organization had some people that were in the Delphi procedure, people that were directors of educational programs in the Netherlands regarding to the pharmacy team. That was a really nice study to perform. Don't be afraid of this figure. I will just, highlight some, just as I did with the table. For Dutch pharmacy technician, we found that there are 6 areas of focus. First of all, very important one, the communication in patient care. Just as I explained, in the Netherlands, the pharmacy technician was more or less designed to do that. So it all comes down to talking with patients about sometimes even very complex medication, but also talking to the team about, what's the way that we're going with our pharmaceutical patient care. The second one is the interdisciplinary collaboration. You should look at the Dutch pharmacy technician as more or less a bridge between the pharmacy and all other healthcare professionals. So as a pharmacy technician, it's important that you know how to collaborate with different kinds of healthcare professionals, with different families, so to say. Collaborative leadership was a topic that was really discussed a lot, because some people were really in favor and some people, mostly pharmacists, were a bit hesitant, because what does leadership entail? Leaders, is it the boss? But collaborative leadership for a pharmacy technician in the Netherlands has everything to do with, forming a bridge, again, between the team, pharmacy assistants and pharmacists. Really being the glue, to say. And also sort of guiding the pharmacy assistant team towards the goals that the pharmacist set for that pharmacy practice. What's left? Of course, pharmaceutical expertise. Well, basically this whole list is important, but our pharmacy technicians in the Netherlands really are well educated in pharmaceutical care, in pharmaceutical basics, in knowing, they're really knowledgeable on how medication works. Then we got organization of care practice, making sure that the pharmacy practice is just run, on a daily basis, the day-to-day stuff that needs to be done to provide good care for patients. You can really hand that over to our pharmacy technicians. And of course, in every medical competency framework, personal development is very, very important. That's to say, we have some educational programs for the pharmacy technicians, but continuous professional education, that's a hard one in the Netherlands. We don't have a lot of programs on offer. So for the Danish situation, I really would like to know, how do you do that? Are there courses you can follow as a pharmacy technician, especially for pharmacy technicians, or do you follow the courses for pharmacists? Another question for you. Do these 6 domains ring a bell? Do you recognize them? Do you use them in your day-to-day work as well? Are you, is this the fundament of a Danish pharmacy technician as well? I'm just curious. Let me know.
I'm just keeping an eye on the chat. So at least I'll say that many of them, the Danish pharmacy technicians, they are very involved in communications in patient care and also personal development. Danish pharmacy technicians, they have a continuing education several times a year. Many pharmacy technicians also have management tasks at pharmacies, and maybe the interdisciplinary collaboration, at least in primary pharmacies, are obviously they have contact to GPs, but not an awful lot. I don't know if there's any other comments. I'm looking out on the audience, and Tina Bolvi has something to say. Tina, please jump in.
Yeah, it's very interesting that those 6 areas. I'm just, and I recognize all 6 areas, but I'm just curious about the volume of these 6 areas. I mean, I assume that some of the areas are higher volume than other area.
Right, yeah. This is a competency framework in general, but as our pharmacy technicians explain, it depends on the pharmacy that you work in. Hospital pharmacies have pharmacy technicians that are really like on a day-to-day basis with this interdisciplinary collaboration. Small pharmacies with only one pharmacist, small community pharmacies. A pharmacy technician would really emphasize the organization of the day-to-day care practice. So it depends on the context where you're working, what kind of domain sort of is on top. But in general, these are the 6 elements that really make up the work of the pharmacy technician in the Netherlands.
So this is the area for the content of their job. Yeah. Right. And how about the education? You have all these 6 areas involved as ingredients in the education?
Well, that's why it was a nice exercise to sort of get this passport of the pharmacy technicians, because we had our educational program, and then over the years we saw from practice that the profession evolved. We didn't really realize that this collaborative leadership was such an important element of the work of the pharmacy technician. So we had to go back to the educational program and really think about, okay, so in our educational schedule, where can we talk about that leadership that is also required from a pharmacy technician? What does that look like? How can we shape that in our education? So it was a nice, going from education to practice, and then taking all our findings from practice back to the educational drawing board to really prepare our students for that practice. And that's what I liked about this research. I saw those students every day, so I could really use my data in education.
Yeah. Very interesting.
Thanks. Anyone else with a question or remark? Anything else going on in the chat, Bjarke?
Nope.
Okay.
I don't see any other hands, so
That's totally okay. Just it feels a bit like early morning education, you know, with pharmacy students. That's okay. I'm used to this. I can see from the hats that, you know, you like what I'm saying, so that's good. Okay. Third part, the practical implications of my research. It's just a small table, but there's a lot behind it, so I'll get you through it. What I aim for with describing those practical implications in my thesis was sort of have a point on the horizon, you know where we're supposed to go with our profession, design the road to get there, and describe, you know, what we'll be seeing at that point in the horizon at our destination. So the first one, definitely important, and I'm really curious to see how that is in the Danish situation. I would recommend increasing the involvement of pharmacists in the educational setup of the pharmacy technician program, because pharmacists and their pharmacy technician in training should really meet up during the program. In the Netherlands, it's 3 years, and, you know, discuss, for instance, the competency framework for pharmacy technicians. They should really together form an understanding of the role of that new pharmacy technician. Second, for the pharmacist and the pharmacy technician, they should be involved in leadership programs together, because they need to familiarize themselves with the possibility of that shared leadership. They're gonna apply changes in the team and the organization and system level of the pharmacy technician. And in my opinion, if they would follow leadership programs, they will benefit from these advanced leadership skills when implementing the profession of the pharmacy technician. What we found in focus groups was that pharmacists all expressed their enthusiasm for the possibility of exchanging experiences with working with a pharmacy technician. So we would propose that those encounters would be facilitated in the curriculum. Peer groups for pharmacists will provide them with information and tools on how, you know, together with the pharmacy technician, decide on that position and responsibilities of the pharmacy technician that's about to graduate and then work in their team. For the pharmacy technicians, I really would suggest to have more pharmacy technician alumni as role models present in the educational setup. I'm really curious to hear about your setup in Denmark, because if you're a pharmacy technician in training, it really matters who you see in that period of education, who you engage with in conversations on the profession, who the ones in charge of your educational program are. If they're solely pharmacists, you know, then who's your role model? That's a pharmacist. That's not your role model. Your role model is another pharmacy technician. Those pharmacy technicians, alumni as a role model in the educational program, should be really followed up with also peer support groups after graduation, in order to continue to learn and to share with peers in a safe environment about experiencing your process of professional role development. You know, you're starting as a pharmacy technician. There are a lot of barriers you can encounter. And then from the role modeling and peer groups, it's only a small step to professional identity formation. It's the learning and development that supports and results in transitioning into a new profession. And it's not often made explicit in education. So I would advocate to address professional identity formation in the educational programs. You know, pharmacy technicians should be encouraged to talk about what defines them as a pharmacy technician, how they experience their role, if there's role clarity, and what they see as their tasks and responsibilities. And the last one, the sixth, you know, I really try to incorporate everyone. It comes down to interprofessional education, because the delivery of effective pharmaceutical patient care requires high functioning and collaborative team with team members that are aware of each other's scopes of practice, competencies, and responsibilities. But as far as the Netherlands, the various team members in the pharmacy team, whether it's a public pharmacy or hospital or outpatient pharmacy, they will meet for the first time on the job after graduation. We don't do interprofessional education. And I really think that this teaching should be part of, the different educational programs for the different team members. And it should also be part of the lifelong learning programs. You should, as a team, have access to training, not just training for pharmacists or training for pharmacy technicians. Just go together. Okay, these were my practical implications based on my research and, with an eye for the Dutch situation. From the educational people, what does jump out from this little list? What do you do already, or what do you consider to be a nice addition to the program? I'm curious.
Thank you. Excuse me. Thank you, Tamara. I got a comment from one of the participants that the Danish pharmacy technician, they predominantly meet pharmacists during their education here at the Danish College of Pharmacy.
Excellent.
There is a possibility for students to be part of a short period at a hospital pharmacy. And then also when they are at their local or at their designated pharmacy, then you have this teaching and supervision by a pharmacist or a pharmacy technician. So you also have some role modeling there. And also the comment continued that when they graduate, there's not a sort of formal education for continuous education, but according to their agreement through their organization, then they have some days every year where they can educate in collaboration with what's needed at the pharmacy. So that was some sort. So of course you can say that the role modeling or the professional identification, they mainly meet pharmacists during their school time or for education. I don't know if there's any other comments for this. If there's any work being done for the professional identification. No, doesn't look
That's
like.
okay. Professional identification information, you can see it come up in the literature on medical education for doctors or pharmacists or whatever, but it's new. We need to think about it. Okay, how to form that in our educational programs. But I would really stress that it's important to also talk about in your educational setup on the profession, the professional that you're training to be, not just the content, not just the knowledge, but also what kind of health provider are you going to be?
Yeah, that's great, Tamara. I have a comment from Marianne, who's a teacher here at Pharmakon. Please, Marianne.
Yes, I shall do my very best. I'm quite rusty in talking English, but I'll try. We have actually changed during the last maybe 5 or 6 years from having guests here on the education and clinical pharmacy subject, from pharmacists to pharmacy technicians to create these role models that you're talking about, because we sensed that there was a distance between the students and the pharmacist,
right?
And we have seen that it is sort of closing this distance. So it's very much, they can almost touch the role model in the classroom when we have those guests. And it's such an amazing change. And we're doing this very much in the clinical pharmacy subject. And a great success, I think.
I'm so proud of you. Excellent. Even before this little talk, you already did that. Because if I look at this list, involving pharmacy technicians in education would be my first step. Students need to see, what they are going to be, and like actually be able to touch them. That's a nice one. Okay.
Tamara, I have one more comment as well, and that's also to do with the pharmacy technician. They are sort of a little bit of an isolated professional group, so they have not had to fight. They have work, and so they haven't had to sort of struggle to fight among other groups of professionals. So maybe this, as no struggle gives no strength. That's a comment from one of the audience.
Right. Yeah. I think the Danish situation is a bit unique, because if you look at other advanced healthcare professionals, like a nurse professional, a nurse practitioner, or in oral healthcare, you also have new professions. Those are professions that are sort of get shifted in between, so everybody has to make room, and that there's a power struggle. It will happen. It will be there. And I always understood that the Danish situation with the pharmacy technician was a bit different, which is good, because then you can focus your energy on what you're here to do, provide excellent patient care. Okay. Any other remarks, or should we close off the session?
Marianne, do you have more comments, or is that just? Yeah, Marianne has more to say. Great, thanks.
Okay. I think it's quite interesting what you're saying, because we are going now to change this this education, take it to a higher level, more formally, and therefore we have to look at the total education again, of both the subjects, but also the amount of practice and more, what do you call it, theoretical study at school. So what I have brought with me now is that we have to keep this practice quite at a high amount, so they still get this role model also in the pharmacy education. But at the same time, we have to look into this new education with more theoretical. It's more like other educations in Denmark, which means we have to wait like this. But the role model thing that you are talking about is very important for me. And also that you say that we have to look a lot more like giving them competence as leaders at the pharmacy. I think that would be very nice here too, because I think this is the way it changes. And maybe we should just let people with low educations do the distribution of products within the pharmacy, and put all the pharmacies technicians out to the customers, and let them have this personal pharmacy technician, as you're talking about, connecting the person, the patient, with the GP and other healthcare professionals. So I have a lot of thoughts in my mind, which I cannot really pronounce, but
that's okay.
This is a try.
No, that's okay. And I'm happy to think along this process. If you need some extra suggestions, or sparring partner, please, we can do that. And realize, don't try to fix this in one day. Please, it takes time. And that's okay.
And particularly about time, Tamara, there's another comment, that is that maybe the bigger problem is that in the Danish setting, the image of pharmacy technician outside the pharmacy is not very, the pharmacy is not very well known.
Right.
So it's not a profession that is had a big professional identity outside pharmacies.
Yeah.
So that's maybe also a problem.
The Where's Wally pictures would really, fit the Danish situation as well. Yeah, that's a hard one. it's exactly the same in the Netherlands. No one of the patients I know can identify the pharmacy technician, which is a shame. Bjarke, shall we continue to our last bit?
Yes, please.
Okay. So Bjarke asked me to sort of predict the future of the pharmacy technician. And what I learned is thinking about the future really requires to look at the now and then focus on what kind of problems are we encountering right now that needs to be solved, because we probably have figured it out in the future. And what are the small little things that start to grow right now? Because, you know, in my opinion, those will probably have flourished in a couple of 5-10 years. So again, in the Netherlands, what really is a big problem is, you know, healthcare, like in general, health of people, having a fit population. So you can see that medicine, healthcare really is sort of focusing from not at the end point when people are already sick, but really baby steps, trying to set in on preventative care, on even lifestyle management. And pharmacy technicians, in my opinion, would be an excellent profession to talk to people, you know, get into the conversation on, okay, so work stress, what kind of food do you eat, you know, the amount of movement you have on a day, really have a low profile, no judging conversation with patients before they get to being patients. What also is starting up in the Netherlands is neighborhood care. So, and I'm doing like this because it's really all about connecting those healthcare providers in a neighborhood. Because if you think about patients, they're not isolated. They're not just one patient going to a GP or that same patient going to a specialist. It's all the same patient that sees a myriad of healthcare providers. So how about connecting those healthcare providers in care teams so they actually know that patients and they know what kind of healthcare providers that patient will visit or needs to visit, and, you know, together come up with a good healthcare plan for that individual patient. Then social media, I must say, the pharmacy setting in the Netherlands, the community pharmacy setting, they're not really big on social media. And I don't mean that we all need to get an Instagram page, but, you know, we need to get out there. We need to show the audience what kind of profession we are as pharmacists, as pharmacy technicians, as a pharmacy team as a whole. What do we do for our pharmacy, for our patients? What does it mean providing pharmaceutical patient care? You know, I'm a pharmacist, but my family-in-law really cannot explain what a pharmacist does, or, you know, how that benefits them. So it always makes me a bit sad that people can really identify GPs, and then the pharmacy care, it's sort of at the end of the line. So with social media, I mean visibility. Not like giant PR strategic campaigns or something, but visibility outside of the pharmacy. And then e-pharmacy. We have now 2 online pharmacy chains in the Netherlands that are actually being reimbursed by healthcare insurance companies. So that's a thing. That's going to be a thing. That's going to become a thing. That's here to stay. And I think pharmacy technicians should also, or well, not should, but could also have a place in those institutions to, again, keep in contact with the patient. So it's not going to be just online, you know, like Amazon, but have a bit of personal pharmaceutical patient care provided to our patients. But these were just my ramifications on the future. You know, I don't have a crystal ball. What do you see in the future for the Danish pharmacy technician? Is it similar? Do you recognize this? Are there totally different things on the horizon for the pharmacy technicians in Denmark?
I'll have one comment on that, and that is about the demand for pharmacy technicians in Denmark is growing.
Good.
much faster than is possible to supply.
Oh.
And so because the healthcare system is highly stressed, both inside and outside the pharmacies. So first of all, we need more pharmacist technicians because the lack of staff is a problem, both when implementing new service and the new forms of education. And the participants say he thinks the unbalance is one of the largest problems for the future development of the profession.
Right. So do the educational programs for pharmacy technician have a sort of reach out programs, like go to high schools or, get those new students in? What do you do? Oh, one more tasks for our educational people here. I'm sorry to keep adding to the workload.
Yeah, there's a comment from Lotte, our director. Please, Lotte.
Thank you, and I'm sorry I wasn't on earlier with the picture. I've listened to you in the driving here to Pharmakon.
That's okay.
We could reach as much out as we like to, but the problem is actually that it's for all healthcare professionals and all social workers, and everything is lacking image, I think, and that's a lack of students in total, or young people in total. But of course, we can should do as much as we can to interest people to take this education. But it is difficult because there's a lot of competitions between the educations.
Yeah.
So yeah.
Yeah, the entire healthcare system needs more staff. True. Very true. Okay. Any other comments on pharmacy technicians in the future? No?
There's no comments in the chat either, Tamara.
That's okay. That's okay. We really got, on steam, everything. Very good. I've reached the end of my talk, the end of the stuff I wanted to share with you and discuss with you. And there's a little bit of time, so you've got room for remarks, discussion, questions. This is the whatever part of the webinar. Let me know.
That's brilliant. Yeah, thank you very much, Tamara. I'll just ask the audience, are there any questions or anything about both the Dutch pharmacy system or anything that you would like? Now we have Tamara online, so this is a good chance to get answers to your questions. Yes, there's a comment from Line, one of my colleagues.
Yes, I would like to ask in the pharmacy technician education in Holland, is the finishing percentage very high? Do they all finish school, or is that an issue?
They do not all finish, but our graduation percentage is extremely high if you compare it to ordinary educational programs. And I think that's because the students we get are originally pharmacy assistants, and they've been pharmacy assistants for quite a year, and then they really internally decide, I want more out of my profession. I want to do more for my patients. So they start with their educational program with a very clear focus. It's not like, oh yeah, I'll just start and we'll see where it ends, but they really know why they want to, follow our educational program. So we have a very high score of graduating people. I like that, but it's also a risk because they're so focused on, getting there. But you have to realize in the Dutch system, it's a part-time education. So they keep on working. They have to do additional education for 3 years. Most of them have a family. So it's quite busy. It's a lot that they take on. So we try to take excellent care of our students. But yeah, I'm really impressed when they graduate after 3 years. Definitely.
Thank you, Tamara. Any other questions or comments, reflections? Yes, there's one more comment, Tamara. First and foremost, thanks for an excellent speech, and I think we can all say that. Could you please elaborate a bit on the length and level of education, and do other healthcare professionals recognize and respect them? So maybe if you start to elaborate a bit on the length and level of education.
Yeah. So like I said, it's a 3-year course, part-time. So they're not in school all the time. They work and learn. A lot of the educational program is workplace-based learning. So basically they have to do assignments at their workplace. So the pharmacist they work for is also involved in their educational program, because he or she has to provide feedback on those workplace-based learning assignments. One of the elements that students find difficult, but they have to do, is a research project. So they have to find an issue in their pharmacy practice that needs a solution or an intervention, or something to make stuff better, and they have to look at it through research glasses, to really use research tools to see if they actually improved something, yes or no. We organize get-togethers for pharmacists and pharmacy technicians every year. So we see them 3 times during the educational program, and we discuss a lot of stuff that I just showed to, also help pharmacists in thinking about, okay, so I got a pharmacy technician in training. What are we going to do when they're graduated?
Okay, and what about in relation to other healthcare professionals? Are they sort of recognized and respected?
Well, I think in the Netherlands, the entire pharmacy system has sort of an image problem, because if I would ask other healthcare providers, do you know what a pharmacy technician is? I think I would start by explaining what a pharmacist actually would do. So pharmacy as a whole has sort of an identity crisis, and that makes it also harder for the pharmacy technicians, because if you think about it, if a pharmacist really has to sort of conquer the healthcare professional world, his colleagues, he has to explain what he does, what his responsibilities are. And then there's this new profession in your own team that also tries to, provide excellent patient care, but also tries to get a little bit of your responsibilities and your roles. You have to fight on 2 battlegrounds, with your colleagues in healthcare profession and then with someone in your team. So that, that creates friction, definitely.
All right. Thank you, Tamara. I think we just have time for the last remark from Lotte.
Thank you. I also like to thank you first for giving this speech this morning and your time. It's been very very nice. I was going to ask you, as little as almost the same as Björn, ask you the level of the education and the comparability to other healthcare educations. Is this way of building the education for pharmacy technicians the same as what you do for a nurse or for other healthcare providers on the same level? Or where is the level, for instance, compared to a nurse?
Yeah, well, in the Netherlands, we have like the general training for nurses. I would say that's just a tad higher than the pharmacy assistant training. And then you have the nurse practitioners. That's like a nurse with advanced training. So I think that would be comparable to a pharmacy technician. It's a pharmacy assistant with a lot more advanced training, and that gets to be a pharmacy technician. So the sort of term that's used in literature is advanced healthcare professionals. And a lot of those training programs or setups or visions behind it are the same as for pharmacy technicians. There's really some resemblance.
Okay, thank you very much.
Okay, thank you very much, Tamara. That was excellent, and thank you very much to the audience for being so active during your presentation. Yes, it was excellent. Thank you very much, and I think there's only to say have a great day. And if you're interested in anything, then either contact me or I can give you the contact details for Tamara.
Definitely.
Thank you.
Bye.
Bye.